Welcome back to Level the Playing Field. This is Dr. Owusu-Akyaw here to answer your sports medicine and orthopedic medical questions. Today we're going to talk about the 3 most common imaging studies that you'll see in an orthopedic clinic. That's X-rays, MRI, and CT scan. Please like and subscribe to get more interesting and informative content just like this. Let's get it. So when you see someone related to an orthopedic injury, and by orthopedic I mean related to the limbs, arms, legs, back sometimes, right? A lot of times the provider may end up getting you imaging, and those images come in a few different ways, a few different types really. X-ray is the most common one. You've probably seen that happens the most often. An X-ray you're probably familiar with. An X-ray really gets a good picture of the bone, right? So let's take it back to a young athlete who's injured their knee, right? They come in to see me. I'm trying to see what's going on. I'm worried about maybe an ACL. I'm worried about maybe a meniscus injury, right? And so a lot of times one of the first moves we're gonna take is to get an X-ray. Now, that X-ray really only shows the bone in detail. You can get some sense of soft tissue around the knee from an X-ray, but really an X-ray is designed to see bone. And so when we do that, we're doing that first to really make sure, first off, you didn't break something, because that takes us down a whole different path, right? If you break a bone in your knee as opposed to have a soft tissue injury, we're going down this path versus that path. So if you injure yourself, one of the first things that you'll have happen when it comes to orthopedics is likely an X-ray. Now, the X-ray can serve for a lot of different things, right? Again, it looks for breaks, broken bones, what have you. It looks at alignment, right? And so if something's out of alignment, right, you'll have some people who, like, for instance, they'll dislocate their kneecap. The kneecap will pop out of place, right? The X-ray will tell me, hey, that kneecap is kind of sitting to the side or sitting straight in the middle where it's supposed to be, right? So X-rays are good for looking for fractures. They're good at looking at alignment, and they give me a little idea about the soft tissue. If you have a lot of swelling in your knee, I can get an idea that it's going on, but it's not gonna give me a full picture as it relates to what's going on. So X-ray, it's usually the first line of imaging when it comes to injury. It's the least expensive, and so from an insurance standpoint, most insurances are gonna want you to have had an X-ray before you think about any other level of imaging, CT or MRI, because their thinking is, if we can catch this just with the X-ray, then we don't need to order that next level of expensive imaging, which is a reasonable thing to say. If it just takes an X-ray to find it, then maybe you don't need an MRI, and then you've saved you, insurance, and us time and money, right? So then we get into CT scans. So a CT scan can be a little bit confusing because it's also looking at the bone, but in a more detailed sense. The way I tell patients or explain it is a CT is almost like a 3-dimensional X-ray. It's looking at, it's giving you more of a 3-dimensional picture, but still looking mostly at the bone. A lot of times CTs happen in more emergency situations, right? So if someone has, say, a head injury and they go to the emergency room, after they had their initial X-rays, their first round of X-rays, a lot of times a CT scan will happen. So if you have a head injury, you go into the emergency room, you'll likely end up with a CT scan of your head, all right? And that CT scan, again, is giving us a more thorough 3-dimensional picture of the bone in your head, right? Looking for breaks, fractures, looking for something out of alignment, like in your neck or in your skull, right? That's where the CT scan comes in. CT scans can also happen in less emergency situations. So if the doctor needs to get a more 3-dimensional idea of what's going on with your bone. Now, an example of that is for, young athletes. A lot of athletes will dislocate their shoulder, right? When you dislocate your shoulder, sometimes you can actually take pieces of the bone with it, but they'll be so small that the X-ray doesn't show it well. In that situation, getting a CT scan can give you a better 3-dimensional picture of how the bone might have been affected by the dislocation. All right, and so that's kind of the role of a CT scan. So think of a CT scan as almost like a more detailed 3-dimensional X-ray. So it gives you some idea about soft tissue, but really it's not a detailed view. Its real goal and focus is looking at bones in an orthopedic situation. And then third is the MRI. MRI is one a lot of y'all have heard about, of course. MRI is what shows the soft tissue, right? So again, going back to the knee example, let's say a young athlete injures their knee. I'm worried about an ACL tear, okay? Now, the MRI is gonna be what we use to diagnose that. Outside of my physical exam, I'll feel the knee, I'll feel if it feels stable, but the MRI gives me the picture to look at the ACL itself. Now, a few misconceptions about MRIs that we need to clear up. An MRI is not a picture inside of the knee. A lot of people think, hey, the MRI is gonna give us everything we need to know and it can never be wrong, and it's gonna see like what's going on, we'll have all the answers. That's not true. An MRI is an excellent detailed view, but remember, it's just a representation of what's going on inside your knee. It's not a picture, it's not a photograph, and they can be wrong. Sometimes they show things are injured that aren't injured, sometimes they miss injury, so MRIs are not perfect. The next misconception I need to clear up about MRIs is some people think that they are the end all be all when it comes to imaging. So what I hear people say is, why even bother with an x-ray? We just go straight to the MRI and get all the information. Now, an MRI is excellent at showing soft tissue, ligaments like the ACL, meniscus, cartilage, tendons, muscle. MRI is the go-to for that, all right? MRIs show bones too, but MRIs are actually not the go-to when it comes to looking at bones. That's X-ray and CT scan. So in some cases, an X-ray is actually a better picture of what's going on. For instance, if you have a fracture, if you have a broken bone, an X-ray is actually gonna be better in a lot of cases than an MRI for that. So it's not that an MRI is just, the end all be all for imaging. It's just more detailed than some things the X-ray can't show. But it's not always necessarily the best thing. It's not always what you need right off the bat. Now, the process for an MRI can be kind of, let's say, taxing, right? And the MRI is effectively a big magnet. MRI stands for magnetic resonance imaging, and basically it's using a magnet to basically get a picture or representation of that knee. And so when you get an MRI, you're going inside what looks like a tube, a small tube, right? And it's a kind of a big machine with a small tube that you kind of slide inside as the patient. And while you're in there, that magnet is running and it's loud, loud. And before you go in, they'll ask you to remove any kind of metal on your person, keys, cell phone, wallet, whatever. And the reason for that is that is a strong magnet. If you were to go into an MRI room with your keys in your pocket, it would literally pull the keys out of your pocket and go flying around the room. It's that strong of a magnet. So when you're in the MRI, a lot of patients, they feel claustrophobic, they feel tight. And that space on the MRI is small. I've experienced myself as a patient. It's small. So a lot of patients will ask to be put to sleep if they struggle with claustrophobia. Now, a lot of times we try to make things a little more comfortable for you for that MRI by giving you headphones, music to listen to, sometimes calming music or even calming medicine. But some people, even that's not enough and they have to go to sleep, sleep for an MRI. So that does happen. An MRI is also a little bit longer than the rest of them. So an X-ray and a CT scan usually takes a few minutes and it's done. Sometimes a CT scan a little bit longer, an X-ray is pretty quick. An MRI can take, depending on what we're looking at or how much we need to look at, an MRI can take, hours. I've seen MRIs take an hour and a half if we have to, get a really good picture of something. And so that's another reason why it can be kind of onerous for you as a patient. So these are things that patients come to me about, and I try to explain it to them so they know what they're getting into, so it's not a surprise when they come up. Another question that comes up is the question about radiation. So let's talk about the 3 different studies and what that means. So an X-ray and a CT scan are really relying on radiation, and that is, radiation like a microwave, right, emits radiation, and X-ray is a different type of radiation than a microwave, but it's using radiation to basically take a photograph of the bones, right? An X-ray is doing that, and a CT scan is doing that in more detail. Remember, we said a CT scan is more of a 3-dimensional picture, and so as you might imagine, there's more radiation involved with a CT scan. Now, when we're getting these studies, we do everything to limit the amount of radiation that you're getting as a patient, but radiation still plays a role. And we know radiation can be bad for, long-term things, right? Radiation in excess, too much radiation, could be a cause of cancer. It can, it can create all kinds of different problems. So we want to limit radiation as much as we can. So we do everything we do to keep it as safe as possible. Sometimes we'll give patients like a lead vest, right? It's like almost like it's not really made of lead, but it's almost like a metal shield to keep you from getting irradiated too much when we're undergoing these kind of studies. Now, in contrast, an MRI, that's a little bit less radiation. Really, the radiation is minimal compared to the other two. An MRI is not using X-rays to get a picture, it's using a magnet. And that magnet, in terms of radiation, is quite a bit safer than, compared to the other two. Now that magnet has other issues, like we said. If you go in there with metal, it could be dangerous. You could have flying objects shooting off out of your pockets if you had keys in your pockets. But the MRI is different in that sense from the other two. I hope that gave you some more information about different imaging studies in orthopedics. Of course, there's a lot more information to learn when it comes to all that. We're gonna get into more details as we go on, so please like and subscribe, continue to follow, and we'll see you in the next video. Let's level the playing field.